Hi, Dr. Milky back with another message about plantar fasciitis. Listen, plantar fasciitis sucks. I mean, it really does. And yes, I'm going to say it. It's a tough condition. It's not like having a bruise in your arm that just goes away. I mean, walking on our heels and trying to get something like this to heal is very difficult. I want to briefly just tell you about the 3 phases of plantar fasciitis. So you might, wonder like what's going on with your heel. So first of all, itis means inflammation, and the plantar fascia, that tendon on the bottom of the foot, can become inflamed very easily. Usually someone's 35 years and older, so that might fit you. And it's not something that just goes away on its own in most cases. That's not that difficult to get rid of. Inflammation of the heel can be treated very easily in most cases, but typically it's got to be caught fairly early. And 6 months into it is not early. The second thing that can happen is the plantar fascia can turn into scar tissue. It can go from inflammation to a scar tissue condition called degeneration or plantar fasciosis. That is much more difficult to get rid of. Very possible, and yes, likely, that it can be treated successfully and gotten back to a point where the heel feels perfectly normal again, but not with like traditional means of stretching and physical therapy and ice and inserts and anti-inflammatories and things like that. The third thing that can happen, which is really the hardest, is a small tear in the plantar fascia. And I small because most of the ones that I've seen are small. Now I have one patient now who's got a bigger tear, more of what we call a full thickness tear of the plantar fascia. That's even going to be more difficult to take care of. But still, this is something that can be fixed and usually doesn't need surgery. But again, with all of these, the longer that the condition has gone on, oftentimes the longer it might take to get rid of it, but still possible. So even if you've had plantar fasciitis for more than a year, or let's call it heel pain because we don't know if it's itis or if it's plantar fasciosis or if it's a tear, it is possible to get rid of the condition. Limping for a long time and all those things are just not fun. So I wanted you to be aware of the 3 things that can happen. And, a lot of people just think, well, someday I'll just go in and I'll just get rid of this. And no, that's not necessarily, it's not necessarily that easy. It can take some time. It is possible. It typically doesn't take surgery, but it's just not going to go away on its own in most cases. See you next time.